Non-surgical treatments are the first and foremost things we offer to patients. When a patient comes in, after we do an adequate and thorough history and physical, we come out with a non-surgical treatment plan to start.
Certainly, we offer a variety of non-surgical procedures. This includes pain management with medications. This includes prescribing the appropriate physical therapy. This includes making referrals for acupuncture or for chiropractic care. This includes injections, such as cortisone injections. However, in patients that require injections to the spine, we're able to perform most of those procedures.
For non-surgical treatment, the downtime for a patient is typically 24 hours. We request that they take it easy for the day of the procedure, but after the first 24 hours, they can go back to their normal activities.
Non-operative care can provide relief of patients' symptoms. Can it cure a problem? Let's just say that the human body is amazing. It could heal a lot of injuries on its own. It just needs the appropriate assistance going forth to be able to heal that problem. So that's what really non-operative care provides. Non-operative care provides the right type of coaching, the right type of information, the right kind of guidance to a patient to help them heal on their own.
To have a procedure performed in an office setting rather than a surgery center or hospital allows the patient to do it under their own time and allows the patient to get back to their life quicker. You're not going to a hospital and having all the paperwork and the red tape. You're coming in among friends, people you already know, our staff, which is great, and we'll get you through the procedure quickly on your own schedule and get you home.